No, I think, you pointed that out exactly. Despite the pandemic, the research in myeloma did not stop. We've had some incredible work happening both at the preclinical level as well as with the clinical side of things. At the preclinical level, we've learned a lot about precursor diseases, MGUS, smoldering myeloma. We are understanding better the genetics. Dr. Harvey Lusat did a beautiful talk on risk stratification. We're probably going to include more risk factors to better delineate risk in myeloma, including chromosomal 1 abnormalities. In terms of preclinical work, you saw a really nice overview by Professor Ken Anderson. He talked about literally what we have in the works in terms of new drugs like the degronomids, some of the new CAR T cells, and obviously, over the last year, we've had 3 drug approvals, Charlie. We've had belantamab mafodotin approved, we've had melflufen approved for the treatment of myeloma, and we've had our first CAR T cell product, ide-cel, approved. So I think despite the fact that we've had a pandemic, research has continued, and I really feel so optimistic for the future in myeloma. It's been an incredible year. I think at this meeting, we've seen some really nice work on immunotherapy specifically. Obviously, the bispecific T-cell engagers, you heard a lot of data around those with talquetamab, with elranatamab, and some of the other newer ones as well, targeting the FcRH5 receptor, for example. So new targets. The other thing which I thought was really quite exciting yesterday was we're still looking at personalized medicine where we're using targeted approaches. Mark did a really nice presentation on looking at BRAF and MEK inhibition in a subset of patients who have those mutations. So that was great. And ultimately, I think we are all so excited about the CAR T cell data. We had a lovely session yesterday. There's more coming today, wherein we talked about immunotherapies. And what I like to believe is we're just at the beginnings of cell therapy. So the data with ide-cel, the data with cilta-cel, which looks absolutely remarkable, is just the beginning. And now we're going to start using the 2nd generation and the 3rd generation CARs and combination approaches, which is really going to be a game changer in the context of myeloma.